Generally, once hormones or neurotransmitters reach cells, they have to induce their effects by acting on different receptors. So here I would like to go over different receptors and the type of molecules that would act on them. So for intracellular receptors, these are usually for the hydrophobic molecules, which are capable of penetrating the plasma membrane and then find the intracellular receptors and act on them. An example of the hydrophobic molecules include the sex hormone, vitamin D, retinoids, cortisol, and thyroid hormone. So all these structures that have steroids inside and are hydrophobic would be able to pass the plasma membrane and act on the intracellular receptors, and from there on they act as transcription factors and regulate gene expression. Then we have the ion channels such as the sodium, potassium, and chloride, which will be opened by different neurotransmitters. Then we have the G protein receptor families, which will act via different signaling molecules called GS, GI, so G is stimulating, G inhibitory, and then finally we have GQ. So the GS will stimulate the activity of the adenylate cyclase, while GI will inhibit the activity of the adenylate cyclase. And what adenylate cyclase does is that it converts ATP into cyclic AMP, and then cyclic AMP will act on protein kinase A, and protein kinase A, it will increase the level of calcium in the heart, and then it will inhibit the function of the myosin light chain kinase. So an example of a GS receptor is the beta-1 sympathetic receptor, which will increase the concentration of calcium in the heart, so it will strengthen the heartbeats. On the other hand, the beta-2 sympathetic receptors, by inhibiting the myosin light chain kinase, they would cause the relaxation of the smooth muscles, so therefore they would be able to cause bronchodilation. And then GQ will act on the phospholipase C, which will itself increase the activity of protein kinase C, and it will also increase the concentration of the calcium inside smooth muscles via the IP3 molecule. So by increasing the concentration of calcium inside the smooth muscles, it will cause contraction of the smooth muscles. An example of the G protein receptor that acts on the GQ is the alpha-1 sympathetic receptors, which causes the constriction of the blood vessels due to the increased concentration of calcium inside the smooth muscles. The next type of receptor is the tyrosine kinase receptor, and the type of molecules that act on this receptor include the insulin-like growth factor, platelet-derived growth factor, epidermal growth factor, and fibroblast growth factor. So these factors will directly act on the tyrosine kinase receptors. And then there are factors such as the growth hormone, prolactin, an immunomodulator like the IL-6, which will act on the tyrosine kinase associated receptors. And these receptors actually function by recruiting the JAK and STAT molecules, which will enhance phosphorylation of different enzymes. And then finally, we have receptors that will activate the guanylate cyclase, which will increase the concentration of cyclic GMP. And one example of these receptors is the atrial natriuretic factor, which is secreted by the right atrium in response to stretch from increased blood volume, and they would increase the concentration of cyclic GMP, which will cause dilation of the arteries and veins. And then there are drugs which will act through the same mechanism, and these drugs include nitrates, like nitroprusside or nitroglycerin, which will convert into nitric oxide that can diffuse through the plasma membrane and then cause the increased production of the cyclic GMP. And then nitric oxide can be naturally produced from the vascular endothelial cells, so arginine in the vascular endothelial cells can be converted to nitric oxide, which increases the cyclic GMP. And then cyclic GMP will cause dilation of the arteries and veins. So these medications, since they would dilate the arteries and veins, are used for the treatment of angina and pulmonary edema. There is this other class of medication, however, that is called sildenafil. And sildenafil, the other name for it is Viagra. It also increases this concentration of cyclic GMP, but it's not acting through the production of nitric oxide, but rather this medication will inhibit the phosphodiesterase enzyme. And phosphodiesterase enzyme is the enzyme that will break down cyclic GMP. So by inhibiting the phosphodiesterase enzyme, there would be increased concentration of cyclic GMP in these patients, which will cause the dilation of the blood vessels in the corpus cavernosum, and thus it will lead to the erection. Now, one important point is that both of these medications, although they are acting through different mechanisms to increase cyclic GMP, since both are causing dilation of the blood vessels, you cannot administer them together. So if you have a patient that is taking nitroglycerin and asks for a medication to help with the erection, you cannot give them Viagra. And the reason for that is that both of these medications will increase cyclic GMP, and then there would be a significant drop in the blood pressure. So just keep that in mind. These two classes of medications cannot be administered together. Now, earlier I spoke about different classes of the G protein receptors. Now I would like to go through more signaling molecules which will act through these receptors, and after that we will be done with this topic. So the memory aid that I've provided you here will tell you which G proteins, the alpha 1, alpha 2, beta 1, and beta 2 sympathetic, then the parasympathetic, and then dopamine and histamine receptors will work on. So the mnemonic that you have to use is called KISS, KICK, 6. So KISS, KICK, and then 6. And so S goes for the GS, which I explained will act to increase the adenylate cyclase. I goes for GI, and then Q goes for GQ. So therefore, for instance, beta 1 acts on GS, alpha 2 acts on GI, M2 acts on GI, and then D1 acts on GS. You can also add V1 and V2 to the list. So V1 is also acting on GQ, and then V2 is acting on GS. And then the function of V1 is to cause a smooth muscle contraction, while the function of V2 is to increase the absorption of water in the kidneys. And the way I memorize it is that V2 is acting on H2O. And then there are endocrine hormones that also act through the G protein receptors, and the mnemonic that you can use for that is called GOAT. So the GnRH, growth hormone releasing hormone, oxytocin, antidiuretic hormone, and then the tyrosine releasing hormone, all of these are acting through the GQ receptor. So you can use the mnemonic GOAT for GOAT to remember that these endocrine hormones are also acting through the GQ receptors. And that concludes our discussion.